great to see you today for this live stream. I am really excited about an upcoming live online educational event that we're going to be doing called Prophy Conference to talk a little bit about the importance of consistency when you're taking your treatment for living with a bleeding disorder. You know, one of the challenges in life is that life gets in the way, doesn't it? It oftentimes impedes progress because consistency is interrupted. And you can have the best treatment in the world, but if you don't take it regularly, you could find yourself in a world of pain that you could have avoided had you just stayed on track. And so I'm really excited to take a couple of days to really talk about some important issues that relate to living with a bleeding disorder. We have some great topics lined up for you that I'm really excited about. We're going to be talking about pharmacokinetics, understanding what PK studies do for you, and knowing where you're at in your map of what you desire to achieve. We're going to be talking about some iron deficiency issues, a metric for therapy of success. I think this is something that is kind of underestimated or not talked about enough, but this is really exciting to see where iron deficiency kind of could play a role in your coagulation process. Dr. Claudio Sandoval is going to be doing a great job with that. He's also going to be talking about prophylaxis for zero bleeds for everyone. I'm crazy excited about that because so much discussion over the past few years has been talked about our annual bleed rates and whether or not that's high or low or what's acceptable, what's not. How about we get to zero? We could do that if we just focus and have the right information. And so I'm super excited about that. We're going to have a ton of fun. We're going to be doing giveaways and prizes and all of that too. And you get to meet people from all over the country in this great event right here online from the convenience of your phone, your tablet, or your PC. And so I hope that you would take some time to go onto our website and register for this event. It's going to be a fantastic time together. And I have a lot of great, exciting things. One of the really cool things about this year is we're doing a second day, day 2. We're going to really be zeroing in on women with bleeding disorders and specifically the challenges that pertain to getting prophylactic treatment regimen or preventative treatment regimen implemented into your care plan. I have invited a good friend of mine and a special guest today, Dr. Amber Federizo, to join me to talk a little bit more about what her session is going to be on with women with bleeding disorders. Dr. Amber, it is great to see you as always. Thanks so much for joining me on this pre-event podcast.
Thank you for having me. And as many of you know, my name is Amber Federizo. I am a family nurse practitioner by training. So I took care of babies and all the way up until, we used to say birth to death. But really understanding that entire timeline of things that change from the pediatrics to the adult side. And my primary focus during the 12 years I was in practice was women. And one of the things I know many of you have heard is some of the language changes around, what are we calling women? There's women and girls with the potential to menstruate. And I do understand that there are many in the community that feel that sort of limits women to their reproductive feature. And so some of the terminology that we'll use in this session is really around algorithm of women with factor VIII variants. And as a company, we're looking at doing, sex-associated bleeding, so female sex-associated bleeding, so that we really get to the heart of everything that women are experiencing beyond just the uterus that they have.
That's so good and so necessary. I think that there's a lot of challenges that are really incumbent upon us as the patient population to put pressure on the status quo, right? And we can speak up and advocate for ourselves. And this is one of the reasons why I'm super excited about your presentation. But you as an advocate for our community have been so outspoken and fierce, really, as a force to be reckoned with to help people understand more about how to have the right language, right? Because there's such a language piece really for us to know enough about our own situation that when we do go sit with our provider, that we can really move the needle on getting to something that's not just acceptable as a low standing status quo, but something that's really where we can get to a place of thriving. And I know you're going to be covering a lot of that in your presentation, but I mean, what are you excited about with this conversation specifically?
I'm excited with this conversation because it gives clinicians and patients a starting point. They know, after diagnosis, what should I expect? What is the next road? If this piece fails, what do I look at next? And what are these metrics of success? And, you alluded to what Dr. Claudio Sandoval will be speaking on, which is iron deficiency, and how we integrate that into this algorithm as how you have success. And if you're not having success at this piece, how you can objectively measure that and when to move on to the next piece. It's been my experience that I've heard women say that, they're just asked about their periods and they say, well, they're fine. And that's kind of where the conversation just kind of stops. And, as long as we're saying it's fine, that it must be fine. But there are actual objective measurements through laboratory testing that we can take a look at. There are things with our hormones that we can look at. We can really get to these objective measures. And there's some people that will say, well, there's not enough data in women and there won't be enough data unless we are all taking a look at this and really finding out what is successful. And I've been very transparent. We created this poster with Dr. Danielle Nance of MD Anderson and the FAIR Coalition. And we've always been open to the idea that if someone says, hey, I think we should modify this algorithm, I think there's another piece to it, we're happy to modify it as a starting point. It is by no means the end all be all, but I'm really excited that it is a starting point and it's a conversation piece that women have and will have as a tool to have these conversations.
It's so good. It's so good. I think that there's a lot of people out there that are getting more access to having a diagnosis even, but they're not getting treatment. Do you think these kinds of tools will help lend itself to getting people to the treatment that they need to?
Absolutely, because I think once we start having these conversations that this is the norm of what we should be expecting, women will be able to advocate for what they should expect. We say advocate for yourself, but really, what are you advocating for? And do you have anything in your arsenal to support what it is you're advocating for? And this is really a tool that they can go back and say, okay, what I'm advocating for is not to have iron deficiency anymore. I shouldn't be if my treatment plan is really working. And if it isn't, we can follow this algorithm and we can make different decisions. And as many people know, again, you alluded to it, language is a key component. So within this algorithm, we do not use the term carrier. There's too much stigma around it. It actually creates a barrier to care. And so you hear words such as trait. By all means, men with hemophilia carry the gene for hemophilia too. We are all carriers in that capacity. And so why are women labeled something and approached differently than their male counterparts?
That's so true. My wife always says this is an X chromosome problem. Everybody that has an X has the problem. Like, why are we having this conversation? If it's not just a male disease, it's also a female. Everyone with an X is got, could potentially have this problem. And so, it's one of those things that I think we need to normalize the conversation of saying, if you have a deficiency in your factor protein, you probably could benefit from supplementing that protein in some capacity, no matter what that is. But if you don't have the right language, like you said, I know in my prophylaxis regimen, my doctors just recently actually said, look, let's reset this to 100% because we can do better. But then I have like my daughter, for instance, who's at 45%, and there seems to be this satisfaction with, it's okay, they're probably not having like this or that. That has something that I think needs, in order for us to move the needle in, we need the patient voice to be really well equipped with the right language, not to be adversarial with their providers, but to be really advocates in that clinical setting so that the research can follow that. Don't you think?
Absolutely. And a lot of this is, culminating all of that information that we have currently into an algorithm, because we'll be diving into additional pieces for consideration. So this algorithm moves beyond just when you have a deficiency, but also what it means to carry the variant itself. So to have that variant, we are all familiar with in sickle cell, we talk to our patients about genetic counseling and we talk to them about having sickle cell trait. And we discussed this in hemophilia as well, that truly some people have trait, they'll have the gene, and then they'll still have issues with bone health, they'll still have earlier onset osteoporosis. So this algorithm will also dive into some of the preventative maintenance that you need to consider as you age, such as many women who carry this gene need to understand that they need to have osteoporosis screening done much earlier. And some of the things that they can do and anticipate and having a care plan around mammogram and all of these things that we need to look at from a colonoscopy perspective. And I never want to see another woman who was told their rectal bleeding was normal and they went on to have, colon cancer because they said, bleeding disorder was the cause of the bleeding. I never want that. I never want to see that again.
Wow. This is one of the reasons why I'm so thankful that you're speaking at this event. And we always love hearing from you because, like I said before, I think we talked about this at the beginning, is that you are a force to be reckoned with when it comes to having that language, and you bring so much insight. And I think every time that we get together and I hear you do one of these presentations, it's like there's so much clarity in the way that you communicate about these issues that is not common. And there's a few really outspoken advocates that I can think of, and you're definitely one of the main people that I look to for a lot of advice for these issues specifically. And so thank you for what you're doing for the community. Thank you for what you're doing for the Hope family. Thank you for what you're doing for all of us, because I think that the issues we are far from done. There's so much more that needs to be accomplished. And it starts really with the education and the understanding, I think, from our perspective as patients living with this. What is it like? Trust your instinct, trust your own intuition as a patient, because it probably is some clinical outcome. And just because historically for the last 45 years it hasn't been whatever way doesn't necessarily mean that change doesn't need to happen, or that there may be a unique set of circumstances you need to pay attention to for you. And really, you're the only one that can advocate for that. Nobody else is going to do that heavy lift for you, right?
Yeah, absolutely. And I mean, it's an important piece to really emphasize that we as women have to put down this badge of honor, that somehow suffering is this thing that we get that, defines who we are through suffering. And so as women, we take on a lot and we accept too much and we accept the bare minimum. And it's now that time to say, you need to put that down, because if you're going to do the best for yourself and be able to do the best for others and take care of them, take care of your family, you have to take care of yourself. And now you'll have the tools from the Hope Conference to be able to do that for yourself. So I think it's really time to stop saying, my grandmother and my mother suffered with heavy bleeding, and they're just like, my friend, you're going to have this heavy bleeding. That's just who we are. We have to change that dynamic. We have to encourage our girls to live better lives and not have iron deficiency, because we're really doing them a discredit and a disservice if we allow it to continue.
That's so true. That's so true. Well, for people that don't know, if they want to register for this session specifically, they can do it right there on our website at Hope-Charities. You can go and register, but it is going to be Thursday, May 23rd at 2:15 p.m. It's going to be a live stream session, but there is one of the things I love about these moments is there's lots of question and answer. And Amber, you always do such a fabulous job with making sure that you get all the questions in that you can and answering all the questions very thorough. So thank you so much for being willing to do this and also talking to us today on this podcast, because we really do appreciate all the hard work that you do for all of us in the community. And it's making a meaningful impact, and we really do appreciate you. So thank you.
You're very welcome. And as always, thank you for having me and having the opportunity to express, because, I could talk about women and healthcare all day long.
Yeah, you should. You need to. We need it. Awesome. Well, we'll see you very soon. And thanks so much for joining me for this podcast.
Thanks. Take care.
Man, that is such an incredible encouragement to see so much passion behind a clinician that has vision for a future for women that have no bleeds and have no ramifications of suffering. And I just appreciate so much all that Dr. Federizo brings to the conversation every occasion that she gets. And so if you haven't registered for this event yet, you can do so right now. You can go to the link below in hope-charities.org and you can register for this event. It's going to be a fantastic time. You can also click on that little QR code above us here and you can see more information about the event. But we want you to be there. This is going to be hundreds of people gathered from all over the country that are coming to learn about bleeding disorders and what that means, and also how to have the right language to be empowered to have the a really an effective conversation with your provider when you have those moments in front of them, and also with your insurance and navigating all of the challenges with that, because I think that there's a lot of hurdles we need to really be experts in when it pertains to living with a rare bleeding disorder. So thanks so much for taking the time to listen to this podcast today, to be a part of this moment. Thank you again to Dr. Federizo for joining me for this podcast. And one big giant thank you to Octapharma, who sponsored this event and so many more. We appreciate their partnership and support of all the programs that we do to help bring the best education we can to the bleeding disorders community. Thanks so much for joining me for this podcast today. And I look forward to seeing you online on May 22nd and 23rd, live and in person with Dr. Amber and so many more. We appreciate you. And thanks so much for joining me today. And we'll talk to you very soon. Take care now.